Hi there. Dr. Henry, with regards to the variants and the sequencing, I understand that takes a while to detect the variants. So do you have sort of I know it's not exact science, but a best guess about how many cases might be out there right now? I know you don't know where some of the cases are coming from, but I'm also wondering if you're able to tell us if they have resulted in more serious or more mild symptoms.
Yeah, so a couple of things that we're learning. So we are following each of these, and as you say, there's a delay, and that's why most of the cases that we've identified so far are no longer in their active phase or are very near the end of that period of time. So yes, we do follow very carefully and try and trace back and figure out where they're from. What we're also finding is it tends to be a younger population. So these are people who have traveled or have been in contact with people who have traveled for the most part. So we aren't seeing severe illness in the number that we've identified so far. Nobody has been hospitalized out of these cases. There has been some transmission within close contacts and particularly within households. And I was on calls this weekend with my counterparts across the country, and we're seeing the same thing, that there are, it seems to be transmitted very easily in some, particularly the variants associated with the UK in what we would, people who were supposedly isolating at home. So we are paying more attention to that and determining, we were talking again with my colleagues in public health on the front lines about how do we manage this. And as you know, last week we did additional testing of people in a school environment to make sure that there was no transmission in that environment, and thankfully there wasn't. But the other thing that we need to do to help understand, how representative these number of cases is, and get a sense of how many people there are in our community that have these variants of concern, is to do what we call a point prevalence study. That's similar to what Ontario did, where they tested, they ran a screening test and did whole genome sequencing on a whole day's worth of tests. So BC CDC Lab, Dr. Pristijecki and Dr. Krajan are working on the process to do that, and we will be doing that as well, so that we do have a better understanding of, are we catching people, or is there more out there that we're missing?
Binder, do you have a follow-up?
I do. And speaking of your public health colleagues, Dr. Davila in Toronto was talking this morning and saying that in Toronto, they're in a transition now from one pandemic to a new one. So suggesting that the variants won't just lead to another wave, but sort of a more serious situation. And I'm just wondering, do you agree with that type of terminology, that it would be like dealing, if these variants were to come here, it would be like dealing with a new pandemic?
Sadly, yes. We've been talking about that a lot, and what we have seen in places around the world, in the UK, Ireland, Portugal, some other countries in Europe, and South Africa is a good example as well, that it does change the game in some ways if it starts to take off and become dominant in the community. And I think all of us are dreading that. We've all been through this, and it's been over a year that we've been doing this, and it really takes us back to some of the ways we were trying to manage the pandemic in January and February of last year, where we were doing case management and contact tracing and controlling every single case. And right now we need to take actions and figure out, how do we find places, people in the community, how do we assess how many cases we have, how much of a risk it is. And what they're finding in Ontario is that some parts of Ontario, it is spreading quite widely, and it's having impacts that we saw that were quite devastating in long-term care homes in particular. So we need to get a handle on it, and this is one of the main reasons why we are extending the restrictions that we have here in BC. And I'm appealing to people to take notice again. We are all tired of this, but it can lead us into a brand new charge of increased numbers of cases if we don't keep doing what we're doing. And I think people in BC recognize that, and we need to continue to make sure we're stopping those chains of transmission. and for businesses that are open, of which we have many in BC, that we have found that balance of keeping businesses open. We need, again, to go back to your COVID safety plans, and you must have one. That is the law. It must be publicly available. Workers must know how to get it. And we need to pay attention to those areas within each of our workplaces, no matter what they are, where transmission is happening. And WorkSafe will be working with you as well, and we'll be doing more testing, more surveillance and inspections, and our public health teams will as well. We know that when we follow the COVID safety plans, they work, and it keeps your staff safe and it keeps customers safe. So those are the things we need to focus on. We don't need to change the way that we're dealing with this, but we need to take notice, because if it starts to spread very quickly again, we need to put in place measures that would restrict our contacts again. So this is the period of time where we are trying to understand what's happening and make sure that we're doing all we can to stop it from taking off again.
2 weeks ago in the briefing, you'd identified 8 cases of the variants of concern. I believe that was the number. We're up to 40 now in 2 weeks. Given that rate of increase, are you confident we'll be able to keep it out of British Columbia? Are there sufficient precautions being taken to make sure that doesn't happen?
Yeah, that is the question. And, this is in the face of increased testing as well. So we're doing quite a lot of testing and whole genome sequencing, which, as we said, is delayed. So some of these cases are people we've identified recently. The fact that we are reducing the number of people coming into the country and coming into the province with the international restrictions that have been put in place, and why we are so focused on people not moving around right now, because we know that the way the virus spreads is by us taking it to other places and spreading it to those that we're close to, and bringing back risk from the places we go when we travel. So one of the reasons that is something that is important right now is so that we don't give this virus legs, or these variants legs, to spread rapidly, while we're still in the process of expanding our surveillance and getting a better understanding of how much is there. I've said this last week, and I say it again, the strategy that we have through the BC CDC makes me confident that it's not widespread, and the testing that we've been doing in, like the school last week, for example, in some of the outbreaks that we've had in the acute care sector, in some of our shelters, and some of the First Nations community outbreaks, we've specifically tested those to see if they're being caused by this variant, and so far they have not been. So those are the things that give me confidence that it's not yet spreading widely, but that can happen very quickly. And we've seen the modeling studies that show if we don't continue to keep a hold on and prevent those long chains of transmission, that it can very rapidly increase. And I know the study from Dr. Kotchin at SFU suggested that we do not seem to have had early seeding of the population with these variants. So we're looking at a time frame into March, that if we can keep control over it for these next few weeks, we can push that out until we have more people protected through immunization.
Sure. On the variants, one that I didn't hear you mention today was the Brazilian one, which I believe Ontario registered its first case of. How serious are you? Do you consider the Brazilian variant versus the other two? Any comments on that virus or variant?
So there's that one, and there's, as we talked about last week, there's a number from the U.S., particularly from California, from L.A. area that we're watching. But all of them have markers, and there's some specific features of each of them that are quite similar. So we are looking for all of those, and we're looking for the 501Y particularly, because it is one of the mutations that's been associated with this increased transmission or transmissibility of the variants, and that's one thing that is in a number of these different variants of concern. So again, we have a whole lot of genetic mutations, and if you remember the phylogenetic tree we showed on Friday, that tells all the different cousins or relative variants that we found in BC, but not all of them confer an advantage to that strain of the virus. And so the variants of concern are the ones that we know are associated with increased transmission, and we're watching for all of them. We have not found any of the variant associated with Brazil here in BC yet, but we are definitely looking for it.